And I'd like to bring the meeting to order. Give us a T. Give us an A. No. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. Other individuals and or the media may also be audibly or visually recording this meeting. So a reminder that all electronic devices are to be switched to a non-audible function during our committee meeting. Madam Clerk, are there any changes to the agenda, please?
We have an added delegation request from Dr. Linda Lukasik regarding item 5.3, an assessment of the Town of Oakville's Health Protection Air Quality Bylaw for today's meeting. We have two discussion items that have been withdrawn. Item 8.2, Sustainable Groundwater Management. Staff advised that this report will be presented at the September 18th, 2017 Board of Health meeting. And item 8.3, Provincial Opioid Response Initiative Funding. Staff advised that this report has been withdrawn as information regarding the funding has not yet been received. There is a notice of motion from Councillor Marula regarding the reduction of airborne particulate in Hamilton, and a general information item, which is correspondence from Ann Warren, Chair of the Board of Directors, Leeds, Grenville, and Lanark District Health Unit, to the Honourable Eric Hoskins, respecting health promotion resource centres.
Great, thank you. Could I have a motion to approve the agenda as amended? Moved by Pearson, second by Ferguson. All in favor? Any declarations of interest? Hearing none. A motion to approve. Sorry, Madam.
Sorry, Mr. Mayor, it's not a declaration of interest, but just mentioned, because you're going to lose quorum, I have to leave for a Committee of Adjustments application at 10 to 1 or 10 to 2. I will come back as soon as possible.
Okay. Do we have quorum in the room right now? Bare quorum? Did you want to put a call out to make sure that others that are in the building, please join us for this committee meeting? Hopefully they're here. If not, we will deal with it when we deal with it. Motion to approve the minutes of June 19th, 2016. Minutes are in your package. Moved by Connolly, second by Green. All in favor? Carried. And a motion to approve the added delegation request from Dr. Lukasik. Moved by Councillor Green, second by Councillor Skelly. All in favor? And I will now ask that we deal with consent items 5.1, which is the Food Advisory Committee minutes, and the Food Advisory other minutes, and the C, the other minutes, and the other minutes. Moved by Connolly, second by Pearson. All in favor? Carried. A motion to receive. We've done that. Dr. Jessica Hopkins, the secondment of extension of alcohol, drugs, and gambling services. Is there a presentation for that?
No, there's no presentation for this. This is just looking to extend the secondment so that we can continue to provide this service for addictions.
Thank you. So the motion's before you. Can I have a motion to approve? Moved by Skelly, second by Collins. All in favor? While we were at it, this is Dr. Jessica Hopkins' last official meeting as Associate Medical Officer of Health, moving on to Mississauga. So we wish you well. I know you'll do, is it Mississauga, right? Yeah, you'll do a spectacular job there. We'll certainly miss you here. Thank you. On item 5.3, the assessment of the Town of Oakville's Health Protection Air Quality Bylaw, we have Matthew Lawson and Andrea McDowell are here to speak to the report. And then shortly after that, we have Linda Lukasik to speak to the report as well. So Matthew.
Through you, Mr. Mayor, thank you. Before you is the report, Board of Health report on the assessment of the Town of Oakville's air quality bylaw. An assessment was performed. The information provided back does provide information. Public Works, Planning Committee, or Planning members of the Planning Department, Business and Economic Development, as well as staff from the city's legal department. Lisa Pasternak attended an assessment of this bylaw to review what the Town of Oakville's criteria was and try and do a feasibility of what it may look like in Hamilton. And before you in the report, I'd be happy to answer any questions that any of the members of the Board of Health have about the assessment.
Okay, thank you. So, Councillor Marula, questions on the report?
Thank you, Mr. Mayor. And as you can recall, I'm not sure when I brought forward the motion, but in conjunction with Environment Hamilton, this particular concept was born and presented to the Board of Health. And I was anticipating, or I think a number of us were anticipating, a positive recommendation rather than a negative recommendation. But having said that, I guess the point remains that in speaking with staff, there is willingness to look at more of a Hamilton solution to the particulate matter aspects or challenges. And so through you, Mr. Mayor, to Matt, could you expand upon, I guess, the difference in approach that we're going to be taking to that of what you've assessed with Oakville, and why we wouldn't adopt what many believe to be a good policy?
Matthew?
Through you, Mr. Mayor, to the councillor. Councillor, one of the main reasons for the outcome of the assessment of the air quality bylaw that Oakville has is that there has been no evaluative evidence of its effectiveness. And without evidence of showing that the bylaw actually works as intended to address air quality and health outcomes, as its title states, and given the high cost to proponents for the bylaw, that in conjunction with information from 2012 from the Ontario Ministry of the Environment about the sector makeup of particulate matter 2.5 micron size, only 15% of the particulate matter in 2012 data, only 15% of 2.5 size micron particulate matter partake in some of the meetings talking about how the bylaw may look and whether they feel that has any conflict with legislative jurisdiction and how they regulate air quality.
Thank you. Councillor Collins?
And our role in that, through you, Mr. Mayor, would be what from a regulatory and enforcement perspective? Where do we draw the line there between what the ministry is responsible for and what the municipality is responsible for?
Through you, Mr. Mayor, I think, Councillor, that would be determined through the process. I don't know where we have that exact point, but I think that we would discover it through the process of defining. If they review, for instance, if they were to review a draft of what the fugitive dust component of a streets bylaw may look like, they would be able to tell us if that were to, yes, you're on your side as the city, you can regulate that. That doesn't step on our toes as the province on our side of regulating air quality.
Councillor Collins?
Thanks for that response. Have we received information from the ministry related to their enforcement activities locally, as it relates to certainly not what's proposed here, but what they're currently responsible for? So I guess I would have many residents who would state that, if the ministry is not enforcing their own laws right now, hard to understand how they'd be a part of a municipal discussion as to how we'd regulate our own. So do we have, I know that's sort of a cynical view to take, but it's one that's largely held by my beach community in particular, and one that isn't going away anytime soon. So I just wondered whether the ministry shares with us the regulatory enforcement activities, any stats that show, how many visits they've made, how many charges have been laid, anything along those lines that would help us for the purposes of building our own regulations related to the PM matters we're looking at?
Matthew?
Through you, Mr. Mayor, that information, Councillor, could be likely obtained from the Ministry of the Environment if requested. Other larger regulatory decisions and tools that could be issued for enforcement here in Hamilton are available to be searched through the Environmental Bill of Rights Registry. As you maybe recall, some of the opacity charges that have been laid in Hamilton. But in terms of the numbers of visits for facilities, that is more granular. And in terms of acquiring that information, I feel that they would likely share that with us if requested. I don't have that information at hand, though.
Right.
Thank you.
Okay. Those are my questions, Mr. Mayor, and I'll certainly pursue other matters offline with staff.
Did you want to formally ask that through this committee or this Board of Health?
Sure, I could, if you'll allow that then.
Yeah, why not?
I'd give the direction to staff to come back with whatever enforcement monitoring activity has taken place maybe for the past 2 calendar years would be sufficient.
Let's do that by motion so it's on the record. So moved by, seconded by Councillor Green, Marula, and Jackson. And we don't have quorum right now to pass it. So I will come back to you when we do have quorum. So in the meantime, we do have Dr. Linda Lukasik here, if there are no additional questions. And Linda, welcome. Has been a champion for our environment and air quality for Many moons,
Yeah, it's been long. I feel like I'm getting old.
aren't we all?
Thank you, Mayor
Welcome.
Eisenberger and members of the Board of Health for the opportunity to speak to you today. I just wanted to take this opportunity with this item on the agenda to raise some other concerns. But before I make comments on this item, I want to also say that Environment Hamilton is a dedicated member of Clean Air Hamilton. So I'm really happy to be here today as well to support our chair, Dr. Dennis Kaur, and his presentation of CAH's annual report from 2016. So I wanted to begin by providing some context. That's why I've thrown this slide up here in my slide deck. My organization is not new to efforts to push for air quality improvements. We've facilitated, initiated, and participated in a number of events related to air quality and particulate pollution in particular, sorry, that's a tongue twister, that have resulted in reports and actions and commitments through the Board of Health. And I would be remiss if I didn't also acknowledge that lots of effort continues to be put into addressing air quality in our issues in our city by public health and the great team there, and other city departments, and by Clean Air Hamilton and its members. But I'm here today because I really felt compelled to respond to this item by making some basic requests in the hopes of seeing more PM pollution reductions on the ground in areas in and around our industrial core. So that's really where I'm focusing my comments today. We've been doing lots of researching, monitoring, and reporting, as the chart shows. But there are some actions that I'd like to describe as low-hanging fruit that I feel need to be pursued, along with a higher level push for action that I'd like to talk very briefly about today. And why am I asking this? Well, I wanted to share with you visually why. These are some of the things that we're still seeing. So these are all photos that I've taken within the last few months. This is along Ottawa Street between Beach Road and Burlington Street. And this one is a series, so I'm just going to go through all three. This is along Steel City Court. This is an area where for years we've had chronic issues with particulate pollution, and a lot of it is drag out. The Ottawa Street shot that I showed you, I know we're still having problems this spring. There have been high levels of fine respirable pollution, that's PM 2.5 particulate. We've got a summer intern, Sean Angel, who's up in the public gallery today, who's been out there doing a whole lot of monitoring with community volunteers, and we know that those levels are high there. So this is an area that we're concerned about as well, and these certainly are not the only areas in the city where we have issues. So we've documented levels of PM 2.5, that's the respirable component that we know is a confirmed cause of lung cancer in humans in these locations and other locations, and we have concerns, but we feel as though something can be done. And I always like to talk about simple solutions, and I think there's some low-hanging fruit here as we work to figure out whether there's a bylaw that could be amended or a new bylaw developed to do a better job on this issue. But I think if there was consideration around proactive implementation of the city streets bylaw and the specific elements in there that speak to the fouling of roadways, that might be a really easy first step to take over the coming months, especially now when it's summertime and there are impacts from these kinds of resuspensions of particulate from drag out from industrial yards. I know right now it's complaints-based that the reactions to the drag out are dealt with by the bylaw department in the city, and maybe something focusing on the industrial core that was more proactive could make a big difference in the short term. And then I know Councillor Marula has already made reference to enhanced street sweeping in the industrial core, and we'd certainly support something longer term that did a better job of that. You know, if we're in a situation where the source, the cause of the problem isn't, the proponents that are causing those problems aren't taking proper steps to rectify them. And I would point out too, the streets bylaw does have provisions in it right now that empower the city to be able to require anyone who's causing that kind of fouling of a roadway to clean it up, and also to impose charges in the way of costs for the cleanup if the city ends up having to go in and do the sweeping and cleaning up. So I'd really encourage, you know, especially if there are problem actors, to make use of those provisions that already exist within the bylaw. I also wanted to talk very briefly about other sources of fine particulate. We are an industrial city, and as you get closer to the industrial core, the levels of particulate do increase. And so I wanted to share a few examples, and again, these are shots that we've taken all within the last few months. This one is ArcelorMittal Dofasco's basic oxygen furnace, and probably anyone who's from the East End will have seen emissions coming out of the hood. We asked recently for a breakdown in the composition of the particulate coming out of the stack, and you'll see from the information that was provided to us that substantial percentages of what comes out when there's a release like this are in the inhalable, and that's the PM210, and the respirable, the PM2.5 range. Here's another example. Hamilton's becoming a center of agri-industry. Some of those players are investing a whole lot of money in very sophisticated pollution control, others not so much. And so we're keeping an eye on and documenting and reporting those kinds of problems. So here's an example as well where you can see what I would describe as off-site or off-boat impacts from loading and unloading practices. And this is a loading area that's immediately adjacent to the Windermere Basin Park, and it's upwind from the Hamilton Beach community. And you've already heard that community has a lot of concerns about air pollution impacts. And I want to share this example. This was a pretty extreme one this spring with a practice that happens again at ArcelorMittal, iron coffining and the kinds of emissions we see from that practice. And I wanted to share these pictures just to underscore the fact that it's not just drag out onto roadways that's a source of particulate. The industries themselves, from stacks and from fugitive emissions, like what you see on the screen right now, that is contributing to particulate levels right from the very coarse particulate down to finer particulate that impacts on human health. And I think it's important to pay attention to these sources too. Okay, so where the Town of Oakville bylaw is concerned, I think it's important to note that the town itself didn't pursue this option until after it made a formal request to the province to establish legally enforceable limits for PM 2.5 and PM 10. And it was an interesting process that they followed. They actually used our provincial environmental bill of rights. They prepared and submitted an application for review that basically argued that elements of the MOECC's Ministry of Environment and Climate Change's air framework weren't stringent enough to protect human health. So for instance, they requested a review of the local air quality regulation, Regulation 419, which is critically important for regulating our local industries, and asked that limits be established for PM 2.5 and PM 10. Right now, that regulation only has a limit for total suspended particulate matter. The response they got back from the province was, no, we think that the framework is fine. And so the town proceeded with the concern that that regulation wasn't protective enough for the residents of Oakville, and that's what led them to the creation of the bylaw. My hope in watching all of that happen was that we would see a similar path unfold to what we saw with cosmetic pesticide use and the ban on cosmetic use of pesticides. We had one municipality move ahead with rules, and that sort of shook the province up a bit and got them to move on regulating at the provincial level. To me, that's the ideal. I think the province is already set up with a framework that's designed to be able to add more contaminants to regulate within that Reg 419. And so I guess the other thing that I'm hoping you'll consider is making that formal request to the Provincial Ministry of Environment and Climate Change that happen. I've also just put this in here because I think one thing, if you haven't heard, you need to be aware of is that Hamilton has an issue in our urban area with high levels of PM 2.5. I know there's hope that that's coming down, and I've actually lifted a graph from the Clean Air Hamilton 2016 report to show you the downward trend at our 3 air quality health index stations that the province runs in Hamilton. But note that, and you'll see in the map below, the yellow circles, that shows the location of those 3 stations, and I would point out that none of them are close to the industrial core, or at least not close enough to give a true picture. And they're superimposed on some of the data that we've been collecting, and the darker colored squares through our community-based monitoring program are areas where particulate levels are higher. So as you move over into the industrial area, you can see there's lots more red and orange. So I would say we need to be tuned into this and pushing and demanding that more attention be paid to this problem. So So I just want to recap very briefly by asking that you please consider doing the following. Proactively enforce Hamilton Streets bylaw to discourage track out violations in the industrial core, and I think that's an easy one that could be quickly put in place. Commit to enhance municipal street sweeping in the industrial core, and then please consider asking the province to develop and implement a legally enforceable regulatory standard for both PM 2.5 and PM 10 through Ontario Reg 419, so that local industries and other local sources are required to monitor and control these contaminants to our air. Thank you very much.
Great, thank you, Linda. Any comments or questions from Linda? Hearing none, okay, thank you. So, two issues. We had a motion put forward by Councilor Marula, so if you want to put forward your motion now, that'd be great.
Excellent. And it's moved by myself, seconded by Councillor Collins, and it's the reduction of airborne particulate in Hamilton. Whereas, over the course of the summer of 2012, Environment Hamilton's Dust Busters project identified many sources of airborne particulate emanating from industrial sources. Whereas Clean Air Hamilton, the City of Hamilton's Public Health Department, and others have highlighted the public health risks associated with breathing airborne particulates, especially PM10 and PM 2.5. Whereas, although track-out issues are not in the bylaw, the City of Hamilton's Streets Bylaw 8677 is not intended for controlling airborne emissions, and whereas the Ontario Ministry of Environment and the City of Hamilton have both an interest in reducing airborne particulate in Hamilton, therefore be it resolved that A, that the Board of Health make a formal request to the Minister of the Environment and Climate Change to establish legally enforceable regulatory limits for PM 2.5 and PM 10 for inclusion in Regulation 419 air pollution, local air quality, and B, that staff consult with Environment Hamilton, Clean Air Hamilton, and the Ministry of the Environment and Climate Change to review the Streets Bylaw 8677 and develop a better legal instrument, as well as other recommendations to reduce airborne particulate in Hamilton and report back to the Board of Health. And just quickly, Mr. Mayor, this seems to be an ongoing saga, obviously, at the city. And as Councillor Collins has mentioned, we get a number of complaints from residents. We have activists such as Linda Lukasic and Environment Hamilton physically out there seeking out these sites and finding these emission problems, reporting them to only be subjected to really no action, or at least being placated by whatever perceived action is being taken. As everyone knows, and I've said 1,000 times, we have legislation in the province that really it's toothless, and until it's actually, and moreover, it's actually the oversight of the legislation itself, or the self-monitoring of it, really is like giving Colonel Sanders the key to the chicken coop. And it is a sad state of affairs that needs to change, but no one seems to want to change it for whatever reason. Having said that, we have what we have legislatively, and it gets frustrating year over year that we have to, in essence, step up to the plate when the province is missing in action, as they are on a number of fronts. But this one here has a serious effect on public health, as you know. In Ontario, over 2,000 people a year die as a result of air pollution. Imagine if 2,000 people a year were being shot or and murdered in this province, what the uproar would be in this community. We don't see the same uproar, whether it's lack of engagement, lack of understanding of the issue itself. But clearly, we spend in this province hundreds of millions of dollars, if not billions, in policing, and very little with respect to something that creates that many deaths in this province. And for that, until there is recognition of the severity and the correlation between air quality and health and death and mortality rate, and it becomes an issue, a ballot issue, I don't think things will change. And until, because right now the corporate entity seems to be controlling the messaging and seems to be controlling the legislative voting, and until it becomes a ballot issue, it won't change. But how we get to it, how we make it a ballot issue, is really the answer I'm seeking and continue to seek. But being vocal is half the battle, and we thank activists such as Environment Hamilton and others, Clean Air Hamilton, who are making a difference, and hopefully one day we'll have a province that actually truly has enforceable legislation as it pertains to the environment, rather than really the joke that exists presently that's toothless and frankly ineffective. And I appreciate your time.
Thank you very much. Councillor Green.
Thank you very much, Mr. Mayor, and having actually attended I think it was a Ministry of Environment session, a public session, particular to a site-specific exemption in the North End with Linda, I think before I was elected. I had a chance to watch Colonel Sanders in action there, where they were deciding for themselves what would be appropriate as it related to the standards of the air quality in our community vis-a-vis the industry. And I was amazed at how many industrial lawyers were packing that room, helping to craft decisions for our neighborhood. I'm wondering, though, based on the presentation that's been here, whether through an amendment or through a friendly, that we don't go ahead and take the first two items and look at the feasibility for what proactive enforcement would look like. I know in our neighborhood, and certainly with all air pollution, it's not stationary. Air pollution is traveling over all of our wards. It might emanate from our ward, but nobody is certainly free and safe from this. And so I'm wondering if we couldn't, with these two recommendations, have them included for feasibility? Okay. Okay, can we, yeah, let's, I mean, they're here today, the consultation. I mean, if through you, Mr. Mayor, just to Mr. Marula, Councilor Marula, if he would consider adding those first two, just explicitly?
Okay.
It is.
I think they're in there.
In the motion, but if he wants to explicitly mention that as a feasibility,
Right.
I have no problem. But it is all incorporated.
Yep.
But I have no problem if the wording, if he wants to amend the wording to include it.
Okay.
Thank you.
Councillor Green, thank you.
That suffices, thank you.
If I could just turn it over to Deputy Mayor Connolly for one moment. So as I recall, we had an enhanced street sweeping policy some time ago, dealing with actually PM10 issues and PM2.5 issues, and fugitive dust and fugitive emissions specifically in the industrial core. So I'm not sure what happened to that. And I also remember that Hamilton Industrial Environmental Association, which for all intents and purposes was pulled together to deal with some of those environmental issues, were somewhat leading that and hoping to make some improvements, and included actually tarp loads and all the other things that allow for kind of emissions to kind of spread around. So I'm not sure who to ask, but do we still do any of that that work down at the industrial area? I mean, it was certainly, I recall implementing an enhanced street sweeping as being requested here today some time ago. So is that off the books, or is not being done anymore, or obviously not being done enough? But I'll get back to you.
Through you, Mr. Mayor.
I got Matthew, and then I'll get to you.
I can speak to the street sweeping effort from specifically in 2013, when the Air Quality Task Force plan was approved. We did engage with Public Works to set out some parameters around enhanced street sweeping. That happened for approximately a year, and I'm not sure what the status ongoing is. I know that there was a lot of construction effort put onto Burlington Street when there was a lot of remake, and at the time there was enhanced routing that they were doing for the year. I will say that there's probably effort that can be applied to touching base with Public Works to understand how we can provide them better information as well, based on our surveillance of environmental conditions, to give them areas, and working with Environment Hamilton as well. In Clean Air Hamilton, through all of those partners within Clean Air Hamilton, we do have a very robust knowledge of where problem areas are. We're looking for more information all the time, but we can liaise with Public Works to understand what the status of that is.
And presumptively, the Hamilton Industrial Environmental Association still operates, still active, is it not? I mean, clearly we should be engaging them on this issue, very directly. I mean, those are in many instances, the industries that are, part of the problem and should be part of the solution.
Through you, Mr. Mayor, I know that Hamilton Industrial Environmental Association is still an active organization. In terms of, I don't know if I'm qualified to comment on what exactly their mandate is and what the goals are. However, we do partner with them on a couple of things, one of them being the forthcoming airshed model, where the Hamilton airshed model that is still being developed, mostly developed, but there are still a few bugs that they're trying to work out. Aside from that, it's just I would hope that it's a best practice community for industry, but I'm not qualified to answer exactly what they're.
Okay, that's fair. Thank you very much. And Councillor Marula, you had some, so you were talking about the funding, the one-time funding for that street sweeping?
So
Okay.
it was out of my area rating,
Right.
but unfortunately, or fortunately, I guess, it can only be done one time, or else it's considered operating under the area rating rules. So unless somebody else wants to volunteer their area rating,
Well, I think it'd be worthwhile for us to consider through Public Works, a kind of an ongoing program that doesn't stop after a year, that, because, I mean, again, the issue doesn't go away, it just keeps on going.
hence the reason I served notice earlier.
There you go.
There.
Very good. All right, thank you very much, Councillor Collins.
Councillor Partridge had a comment.
All right.
Did you? You okay?
Okay, Councillor Partridge. Okay, so we have a motion before you, moved by Marula, seconded by Collins. All in favor? Carried. Councillor Collins, you had a motion as well?
I do, and it's that staff be directed to contact the Ministry of Environment and Climate Change to obtain MOECC monitoring and enforcement information pertaining to air quality and fallout complaints in the City of Hamilton for the years 2015 and 16, and that the information be summarized and presented to a future Board of Health meeting.
Thank you. Moved and seconded. All in favor? Carried. Thank you very much. Could I have a motion to receive the report, please? Moved by Partridge, seconded by Pearson. All in favor? Carried. Thank you. Okay, now moving on to further clean air reports. We have Dennis Corr and team here from Clean Air Hamilton doing great work in our community to let us know where we're at and where we're doing well and where we're not doing so well. Always great to see you, Dennis.
I'd like to begin by thanking Linda for her very persuasive presentation. And I'd also like to thank this group, as I do every year. I'm going to show you some trends and charts. I do bring you good news, somewhat modified good news, but we in the air quality community really appreciate the ongoing support from this group. There is a reason the air quality is overall getting better in Hamilton year by year by year, and we thank you for that. And we thank Public Health for their support as well. I'm going to preempt a little bit of my own presentation because at Clean Air Hamilton, just last Monday, we were discussing some of these issues, and we did pass a motion that we really support strengthening the drag-out bylaw to really enhance it and make sure it covers the environmental and health aspects of airborne dust. And I just want to say before I get into my charts, it's easy to say it's a complicated issue, but we really do need the full court press on this. It's not simply industry from point sources, as Linda has pointed out. It is the resuspension of road dust, and the city themselves have a very large fleet of diesels. I was driving along behind a city bus on Wednesday, I think it was 0905, and brown, dirty smoke was billowing from the bus. I know that about 10 years ago, when Chris was fleet manager, the city used to have a specific servicing and tuning approach to all the diesel engines that were used in the city. It was called green tuning, and I don't know if the city still does that, but just anecdotally, I seem to be seeing more emissions from buses and city vehicles in recent years than I used to, and that is something that would also bear looking at. I'll just go into my regular presentation now. I'd like to take a slightly different approach and say to you that air quality in Hamilton is more than an environmental issue or a health issue. It's a huge financial issue for us as a city as well. And I just did a little quick analysis of the value, the aggregate value of all the residences in the city of Hamilton. In the year 2011, that was $60 billion. By the year 2016, that was $90 billion. That's a lot of money. By 2017, that had leapt up to $112 billion. That doesn't count all the city land, all the industrial land. So as I stand here today, I'm looking at the board of directors of what's essentially an organization that has probably about $200 billion net worth, plus or minus. And of course, this has a direct impact on the tax base for the city. And our city's value has exploded by people coming from Toronto. There's a lot of good research that shows that the price of houses is quite directly related to the air quality in an area. Now, I'm not trying to say that the increase in value of Hamilton is just due to better air quality, but I do think the increase would not be as large if we still had the air quality levels of the 70s. People would not be as anxious to come to our city. So this is a big financial issue, as well as an environmental issue and a health issue. So I'm just going to start by showing you Clean Air Hamilton. I believe Clean Air Hamilton is actually unique in our city. I don't know of any other organization that covers large industry, small industry, activist organizations, federal government, provincial government, municipal government, public health, and the local educational institutions. We're very strongly science-based. We do believe that any actions that we take as a community should be based on the monitoring, should be based on the data. And I can tell you right now that we did do monitoring. We used the Ministry of the Environment Mobile Air Monitoring Unit when the enhanced street sweeping was put in place. And we were able to show a dramatic improvement in the industrial area in both PM10 and PM2.5 as a result of that enhanced street sweeping program. In fact, we published a research paper about it. So I don't know if it's still going on, but if it isn't, it should be. This is the good news. The total suspended particulate levels, we've seen a 55% reduction over 20 years. You can read as well as I can. So the bottom line is we've seen a 90% improvement in Hamilton's air quality since the 1970s. And we should all be proud of that. But we got to keep on trucking. One of the things that we wanted to draw attention to today was PM 2.5. And the reason we wanted to draw attention to it was that we had particular concerns over the last couple of years because the federal government had introduced new legislation. The Canadian Council of Ministers of the Environment have a new approach to improving air quality, and it's air quality, called the Air Quality Management System, AQMS. Of course, it doesn't exist in government unless it has an acronym. And there are Canadian ambient air quality standards. And the Canadian ambient air quality standard for PM 2.5 is 10 micrograms per meter cubed for an annual average. And let's see if I can. We exceeded it in 2014, 2015, and actually in 2013. And we were the only city in Ontario that exceeded PM 2.5. And we were very much not happy about that. I am now happy to report that we have come down and we are now well within the Canadian ambient air quality standard. This is no time for complacency, however, because we're still very close to it, number one. And number two, in a couple of years' time, this standard ratchets down to 8.8. And the part that this chart does not show you, that the federal government takes the highest level of the 3 government monitoring stations in a community, in our community, so that we are actually closer to the 10 than you would think by looking at this chart. So we really have to focus on PM 2.5. As I say, it has to be a full court press. Addressing one thing is not going to improve this problem. These are the overall trends. So if we look at the heavier particulate, it has come down slowly but surely. The inhalable particulate, that's PM10, which ends up in the center of your lungs and is a health problem, but not as bad a health problem as PM 2.5. It's been coming down steadily too, and this is the PM 2.5. We are the red line, and you can see we're in the same group as everybody else. Here's another reason for us not to be complacent. If you look at the trends of all the cities, we've just gone down with everybody else. Now, considering that we have a huge concentration of heavy industry, this is a big win for us. Just to be as good as everybody else really means we're better than everybody else, because they don't have the concentration of heavy industry that we do. But the fact that all these cities are going down together probably means a lot of this benefit is because we're having reduced input from the United States, since about half of our air pollution comes from the US. Not quite sure what happened there. This is our sulfur dioxide trend. Benzoate, pyrene, and benzene. The message from this is that the pollutants that are locally produced are the things that we have made the most progress on, that there are specific actions that the terrible old Ministry of the Environment and Climate Change can take and have taken and have resulted in those improvements. So these are more specific pollutants that you can say, for instance, for TRS, the steel companies used to do slag quenching, which generated a lot of stinky stuff. They were told they had to change to slag pelletizing, which really reduces the TRS, and then you can see the TRS dropping as a result. In Clean Air Hamilton, we support a number of outreach and community projects, which I would be remiss if I don't mention. We don't just focus on the big picture stuff, we also do direct outreach. So we do this through Green Venture. I do it myself. We go into the classrooms, and one of the things that we do is people are really interested in the air quality in their own community. So we have developed a website with Professor Matthew Adams, and I keep pressing the wrong button here, www.hamiltonaqhi.com. So every hour you can see what the air quality is in your own neighborhood by looking at this. And we have combined some of these for our 2017. So the Fresh Air Kids program, where we're going to the schools, is combined with an anti-idling program. And we're also doing a project with Environment Hamilton with building these little air monitors. So these are our future actions. We're going to continue to support the recommendations of the Air Quality Task Force, including related to air monitoring. We really want to push to get more PM 2.5 air monitoring. because the industrial Hamilton Air Monitoring Network does not have any PM 2.5 monitoring right now. The city has stepped up, specifically Alderman Collins, and bought a couple of portable air monitoring stations which are moved around the city, and they will measure PM 2.5. We're working at reducing transportation-related greenhouse gas emissions, including supporting the LRT.
Thank you.
Yes, I was hoping for the thumbs up on that one. We have proposed and done the basic research for a bicycle highway which would go along the foot of the mountain and the top of the mountain. And Alderman Jackson has already started doing that, I believe, in the East Mountain. That is actually stalled right now. We've done about as much as we can in terms of the groundwork for that. We've identified that surprisingly, even though it's a big idea, 93% of it already exists in one form or another, but somehow we have to find the next quantum leap in funding to start making that happen, and we don't really know how to do that. We support the expansion of electric vehicle charging stations. When I came last year, I said, the world is going to electric vehicles. We need to be able to assure people who drive into Hamilton that they can charge their vehicle. I personally know of someone who is prepared to buy an electric vehicle, but he couldn't be assured of getting home again in the evening because there might not be a charging station available for him. So I think that's something we should really go all in on. And of course, we support other groups with the same objectives as ours. And why? You just look at the bottom pictures, and we should all think of what our children and grandchildren are going to be saying to us in 15 or 20 years' time when they look at us and say, all the information was there about climate change, about air quality. What do you do about it? So, thank you.
Thank you, Dennis, for all your many, many, many years of work on that area, not both at the ministry and in your retirement. Interesting retirement for sure, but you're keeping busy, and certainly I appreciate, and I think we all appreciate the effort you're putting into monitoring and pushing us along on terms of the air quality spectrum. So thank you very much for all of that great work. Any comments or questions of Dennis Corr? Councillor Green?
The superhighway. This is the first time I'm hearing of the superhighway, and I'm just wondering the quantum leap that you're looking for. What's the scale and magnitude of a project like the superhighway?
Through you, Mr. Mayor, we had this idea about probably 7 or 8 years ago that we thought it would be wonderful if you could get from one end of the city of Hamilton to another, either along the foot of the mountain or the top of the mountain without having to be near cars. And I'm sure all the car drivers would love that too, as we've seen on Cannon Street with the separation. This was driven really because the rail trail in West End Hamilton is so beautiful and so heavily used.
And the center part of the mountain as well, sir.
Also in the center part. The thing is, if you start there, you end up at the top of the mountain, and then you have to come down the Red Hill Creek through, you know, all this sort of stuff. So we, I guess, we have a very small amount of funding. We've got like $30,000 or $40,000 a year compared to the billions we're earning for Hamilton every year. So we have had the geography department at McMaster do the basic work, but it really needs an engineering study at this point to see how much it would cost to start making this a reality. And we did a very, very rough estimate that to put the whole thing in place would be of the order of 10 million. But you would have to have an engineering study of, I'm not sure, maybe between 60 and 100,000. We're not engineers, so we just think it could be a real signature piece for Hamilton that shows the kind of city that we are becoming.
Well, through you, Mr. Mayor, I would say I'm certainly interested in pursuing what this vision looks like, I'd have to do it after having met with you guys and getting a better understanding for what that might look like from, I'm hearing 160 to 100,000 for an engineer's report. But I think it's one of those projects, Mr. Mayor, that you need to start. Like it needs to happen. If it's a 10-year project, then it needs to be 2027 or whatever it's going to be. But it's got to start sometime. So I'm certainly happy to follow up with you offline and look at what a super highway might look like through our downtown core, because you're quite right. People do use the rail trail quite a bit, and we are always happy to connect with the good ward councillor Jackson up there in Ward 6, but without any connectivity north and south to the streets as off-ramps as you were on the super highway there, it's a very difficult thing to make it kind of an everyday use. So I'm very interested in that aspect of your presentation. It's the first time I'm hearing of it, and hope that you will follow up with me so that we can potentially pursue this study as necessary. Thank you.
Okay, thank you. Councillor Jackson.
Thanks, Mr. Mayor. Dennis, thank you always. And between people like yourself and Dr. Lukaszuk, we're lucky to have people like you with the talent and experience you provide and your passion for a cleaner environment across our city. Can I ask you quite bluntly and honestly, Dennis, rewind the tape about 30 years when Hamilton was still the industrial giant that it was. With all the programs we've put in place, all the initiatives through municipal government and some support from senior levels of government, all the stakeholders in the community, and all the improvements, you've said we're on the right track, and the good news overall you've given us today. My point I'm getting to is if we rewind the tape 30, 40 years when we were still the industrial giant and we still had 30, 40, 50,000 jobs along Burlington Street in the industrial area, would these programs still have been as effective, or is it because primary industry has declined enormously in our city that has helped along the transformation of cleaner air in our city? I'm just trying to, it may be an unfair comparator of the two eras, but I'm just trying to, I guess, reinforce these programs and initiatives are very effective, and they're effective now, but they could have been as well effective back then. Mr. Mayor, through you to Dennis, please.
Through you, Mr. Mayor, that's an excellent question and comment, and it's one that I get all the time. And my answer is absolutely not. And people say, oh yeah, it's because the steel companies are nearly closed down, or Stelco shut down. But if it was because of a specific moment in time, you would certainly see that in the data. Like you'd see that long slope going down and then a sudden drop. And we're not seeing the sudden drop. And we're not making any less steel, I believe. It's just that the process has become more automated. And it's a worldwide phenomenon in every industry that we're using less human beings and we're using more automation. The steel companies didn't get any smaller, and in fact the steel company is, my understanding, it's like a nuclear reactor. You can't turn it off. You either run it or you don't. And even when U.S. Steel was very nearly shut down, they were still running their coke ovens and supplying the coke over to Arcelor. And you can't shut down a coke oven unless you keep burning natural gas in it because the bricks crack and all the rest of it. So these big companies, they're either on or off, and they've had incremental controls on them one after another. I mentioned the TRS issue with the slag quenching. It was changed to a better system, and they keep being upgraded. To me, the danger is if they're running low on money and they're not repairing and maintaining the way they should be, if anything, that tends to push the emissions up. And if I could just go back, because there's a very interesting thing
Please.
that I didn't draw attention to. See this? Mm-hmm. This is what really makes the difference. Look at the year, 2008, 2009, 2010. When the world economy went in the dumpster, there were less trucks driving around, there were less diesel emissions, there was probably some less steel produced. There was just less activity everywhere and then the level of pollution went down for PM 2.5 and many other things as well.
Okay, so that's even more encouraging, Dr. Kaur, from what I've interpreted and what you said. And thank you very much for your personal attendance in the past with my East Mountain Community Group and helping them as well with airshed issues up on the brow and being overall supportive of that network that we began there along the brow with the reconstruction of Mountain Brow Boulevard and the multi-use recreational trail. Thank you, Dennis. Thanks, Mr. Mayor.
Okay, thank
Thank
you. Any further comments or questions for Dennis Kaur? Hearing not, Dennis, thank you so much as always, and we'll look forward to the next update and continued improvement.
I don't know why I always get so nervous coming talking to you guys, because you're always so nice to me. Thank you.
Were they all your grandchildren up there, by the way? Yeah. Wonderful. Isn't that wonderful? That's what retirement's about.
They're the ones that I'm afraid are going to say to me, you know, in
Yes.
50 years then, hey, guy.
Well, they can't say to you that you didn't do anything, that's for sure. No doubt about that. Thank you. We don't have quorum in the room, so we cannot receive the report, so I will come back to it when we do, and hopefully those that are within earshot will ensure that they come here to provide quorum for us. In the meantime, we have item 7.2, the Ontario Public Health Standards Modernization Implementation Update. We have Dr. Elizabeth here to do that. And before we do that, a motion to receive report air quality, Clean Air Hamilton 2016 report, item 7.1, moved by Johnson, second by Connolly. All in favor? Carried. Thank you. Dr. Elizabeth, welcome.
Hello, good afternoon. Let's see if we can get this at the right level. So I was a little intimidated at the idea of following Dr. Kaur in this presentation, knowing just how positively he was received and how dynamic a speaker he is and how much more interesting air quality is than talking about our standards and what they mean for us and where we're going. So I'll try and keep it brief and
throw in some family pictures. I think it always helps.
I'll throw in family pictures next time and tell stories about them and their travels, and that might help a little bit. This is just to give an update on where the province is going with the whole public health transformation process and our standards and what the Board of Health is accountable for in terms of moving forward. And so just to remind ourselves, the transformation process for public health really is based on a few things. The public health work stream work, which just actually received a draft of last night in terms of the relationship of medical officers of health and the LHINs and boards of health and the LHINs going forward. And so we'll have some more information for you on that shortly. It's all good. It's all positive. It's about looking at integrated systems, making sure we're meeting the needs of our communities, making sure we're addressing issues of health equity. And so all very positive, the stuff that's coming out of that stream that we've seen to date. The expert panel on public health is the other piece, which was looking at the structure of local public health agencies. That's a piece that was advice to the minister. It has gone to the minister in mid-June. And as it's advice to the minister, it may or may not be something that comes out from government subsequently. We won't know really for some time in terms of what is decided to do about that. I do know that the minister is very interested in it. It was something he was actively following, but not sure where he'll go. And this final piece is the piece I'm talking about today, which is the modernization of the standards. So reminding ourselves about why the province has chosen to go down this route. There's three sort of key factors: looking at improving public health responsiveness to emerging evidence in Ontario's priority issues. So in other words, that the standards do evolve in time and are getting at priority health issues in Ontario. To better connect public health to the broader healthcare system. And so this is really a key point at which we're bringing public health expertise, knowledge about our communities, knowledge about health issues, knowledge about things beyond individual health level services that really impact health and how that can be brought together with actual health care. It also gives us an opportunity to look at what we're delivering and how that fits with our health systems partners. And finally, to demonstrate the contribution and value of public health is the third one from the minister. So, getting back to the standards themselves, there's a reorganization which we talked about back in February. So we've gone down to 8 standards. And the standards, I realized as we were preparing this that I often talk about the health protection standards and the health promotion standards, but don't clearly identify which are which. So did that in this slide today. which talks about those health protection standards being around healthy environments, safe water, food safety, immunization, infectious and communicable diseases, prevention and control. So all kind of the standard health protection stuff we know, while the health promotion ones are around healthy growth and development, school health, and chronic diseases and injury prevention. So why is this important, this distinction? It's because they essentially expect us to do very similar things across the province so that everybody experiences a very similar level of protection wherever you are in this province around these key health issues. On the other hand, when it comes to health promotion around healthy growth and development, chronic diseases, those sorts of things, they are expecting us to tailor our programs and services more to the specific needs in our communities. So my favorite example, which people up in the audience from our staff has heard a few times, is looking at the issue of teenage pregnancy. So here in Hamilton, teenage pregnancy is an issue, so we need programming that addresses that. In Peel, with their particular population characteristics, it's not a big issue. So you wouldn't expect them to develop a program where one isn't needed. And so that's really what they're getting to when they talk about these sorts of issues. They are ordered in a particular way in that those top two, the healthy environments one, and sorry, I didn't bring immunization up in the end when I did this, but they do still have a flavor about customizing it to the local environment and what we need. So we're going through and looking at all of our programs and services. And I'm going to just tell you a little bit more about what staff is doing in order to bring that about. But essentially, we're taking the approach of if you were to start over today and look at all of the health needs that we have within our community, the particular mandate, so if you look at this, the broad health needs that we might identify, the particular mandate of public health, we're not meant to go and start being public works or start being hospitals or anything else, but what's within that mandate, then what are the things that we can actually do something about? Because lots of things we don't yet know how to intervene in terms of making a difference. And finally, looking at those things that are going to make the biggest impact, going through that assessment and then looking at what should be within our programs and services within those mandates. So we have staff working on that at present. We're doing this all using a background of population needs assessment, population health assessment. And so this is just one example of the work that we're doing to understand what the needs are in our communities. And I do say communities because it's not just all of Hamilton, it's within each of the parts of Hamilton and how do things vary and geographically, but also by income, by other social determinants of health. So this was one that was just done up for some of the planning that's being done in Dundas. And it's one of the first ones we've produced, which looks at things like, you know, our residents and their age. It looks at our, is the population growing or not? What are the major health issues? How much do people visit the emerge department? What do they go there for? Looks at issues about diversity. It looks at issues of opportunities that are there. What are the major causes of death? So if you remember back to the Code Red neighborhood profiles, we're getting closer and closer to providing the kind of detail that was there and looking at how are the experiences very different across our communities. So this is information that we are planning to bring back to council as we get it all collated to be reviewed later on in the fall. The other thing, though, is that as we get better and better and get more and more data sources for this, it's really an iterative process, so it'll become more in-depth, more information that's included with it as we go forward. So as I said, we have staff going through and looking at all of our programs and services. For some programs, that's a briefer process. It's really looking at what are our particular needs here, how many food premises do we serve, you know, what sorts are they high risk, low risk, just reviewing all that and looking at our service levels. For others, it's a much more in-depth review as we try to hone in on what are the particular areas that will continue to be of focus. So for each of those teams, there's management and staff leads that are working on it. There are epidemiologists and health analysts and evaluation specialists who are helping to draw together the data and the literature and all those other sources of evidence as we move forward. And then there's a senior management lead who's overseeing the process and making sure we are doing it consistently across all of our services. Bottom line, though, when we get through this whole process is there's always going to be more to do than there's money to do it. And so we're quite aware of that as we go through. The commitment is for us to look at this within the current funding envelope that we have. And there may be some trade-offs that need to be made, though, as we go forward. So what might you see as we go through the process? Well, we may need to look at specifically what are some of the programs and services that are carried out. So where there may be different things done today than there will be done starting in January of 2018. A specific example of that is vision screening. We did that when I first started in public health 25 years ago and had done that for a while. But the evidence didn't show it was making any difference. And so it was stopped. And now there's an interest in that again. And so it's not something we do. We are required to look at that and how it might be done. So you're going to see some information around that. What's another piece that's new is just there's going to have to be very explicit demonstration of how it's decided in terms of what's going to happen. So it's going to have to be very explicit about the needs information, that this need was greater here than another need, that there was good evidence that the intervention that is going to be done, the program run, the service offered is going to make a difference. And we're going to have to link that to really showing about impacts on health outcomes. So Councillor Jackson, and how you challenge me regularly, which I really do appreciate, about obesity and physical activity and how are we really showing that we're making a difference. We're going to really need to get better and better at that. And we're going to need to do that process. This isn't a one-off thing. We're going to need to do this year over year over year as we move forward. Not necessarily redesigning every program, but showing this evidence. For our staff, you can imagine that there's a considerable level of impact. They're looking at a whole new framework in terms of moving forward and looking at needs. They're developing tools as we go and implementing them right away in terms of measuring program performance and those sorts of things, and they've got those well underway. There's a lot of time, particularly in those three program areas of chronic diseases, school health, and healthy growth and development, to do the in-depth review, and given the changes that we see in the standards and what we're expected to do. And of course, our staff are also concerned about what this means for them in their practice. So if they particularly were involved in public health in Hamilton because they loved offering a particular service that the province no longer requires us to do, or it doesn't end up being one of the most highest need ones on our list as we go forward, there's going to be some changes they're going to experience, and it's been a hard time for them. They've had a lot of change over the last couple of years, and so that's difficult for them as well. So I'm going to move from the programs to the accountability framework, and it's dry and it's not terribly fun to look at these large charts that the ministry has provided to us. For those of us who do enjoy getting into the details and understanding, they've certainly provided us with lots of details in terms of what the accountability expectations are that they have of the Board of Health and of staff moving forward. So they've now laid it out in a slightly different way too, that there's responsibility around delivery of programs, accountability around our fiduciary requirements, so around use of funds, around good governance and management practices, and good public health practice. The bottom line, really, if I was to reduce the slide, is they expect us to deliver good programs. They expect us to meet the mandate, bless you, it's set out. They expect us to use our money efficiently and as is intended, so money is only spent on public health programs and services. They expect there to be good governance and good management, provide a high standard and quality of programs with measuring of performance and continuous quality improvement, and provide documentation to show we're actually doing it. So a lot of this isn't a big shift, but what we've heard is that this demonstration of it and really being able to be sure that it's all happening is something that they're concerned about. There are a number of different things, and I'm not going to go through the whole list, but there are a number of different things we now have to put together and sign off on. There's a detailed service plan, and you may recall seeing these in childcare systems management and other areas of business within the city. We now have to do this very detailed planning and submit it for approval here and submit it to the province. We have to do detailed budget submissions with program-based costing. We have to do a risk management report, a stakeholder report, an annual report. So there's a lot of report burden, if you will, but it is stuff that is there to show that we're actually doing the work that's important to do. From a timeline perspective, the expectation of the province is that we get our implementation of the new standards in place for January 2018, they know that it's going to take some time to get to full implementation. Indeed, we won't even have some of the protocols until late this year, so we can't possibly be ready to go on January 1st. But we do plan to come back to you in November, as I said, to give information on health needs and priority populations and our risk management plan. In January, if we need them as we go through the process, we may ask to hold some focus groups to get some feedback on some of those trade-offs that need to be considered. Then come forward with the full budget in February, the full plan and budget, and submission has to be to the province by early in March. Can it all be done? Well, it's going to be a fair amount of effort for us. Are there things that may get in the way? Certainly, if we've had over the last few years some rather significant public health issues that require us to turn our attention to them, things like the immigrant and refugees and measles outbreaks and the like, so those could certainly throw us off track. And the organizational changes that are happening are impacting staff productivity and are taking time away to do those activities. And so depending on how that rolls out over the next while, that may impact our ability to get it all completed as well. And that's it.
Okay, thank you very much. Any comments or questions for Dr. Elizabeth? Hearing none, can I have a motion to receive the presentation? Moved by Pearson, second by Conley. All in favor? And on the report itself, item 7.2, can I have a motion to approve? Moved by Pearson, second by Conley again. All in favor? Carried. We're going to turn to item 8.1, choices and changes. The funding, or the report is in front of you for choices and changes and other funding grants. Unless there is questions of Dr. Hopkins and Susan Boyd, we can approve the report. Moved by Skelly, seconded by Partridge. All in favor? Carried. Items 8.2 and 8.3 have been pulled and are going to be with us sometime in September. We have an amendments to the outstanding business list. So can I have a motion to approve the revisions? Maybe the revisions are, I mean, this is the revised document here, right? Yep, okay. In the absence of questions, moved by Johnson, seconded by Collins. All in favor? Also a motion to receive the correspondence from the Minister, Ann Warren, Chair of the Board. Moved by Johnson, seconded by Marula. All in favor? Carried. A motion to receive correspondence respecting the Health Promotion Resource Center. Moved by Skelly, seconded by Jackson. All in favor? Carried. And if there is no other business, a motion to adjourn. Moved by Partridge and everybody else. All in favor?